much for coming, especially in December, on almost the last day of classes. Thanks for turning up. This is the second event in the new series called Autonomies of the Hannah Arendt Center Student Fellows. We had an event last week with poet Holly Melgard, and now we are delighted to welcome Oliver Hall. I'm not going to say much further, but leave the introductory words to our student fellow, Nick. Thank you so much.
Everyone, welcome, and thank you so much for being here. Thank you, Oliver. Tonight's speaker is Oliver Hall. They are from Kentucky, and they are the current director of the Trans Health Advocacy Program of Kentucky's Health Justice Network, which fights for reproductive justice, the needs of advocacy, education, and for providing direct services to the local community. They have a degree in political science, alongside with minors in Advocacy Studies, social change, and philosophy. They have also been a leader of Cries United Against Sweatshops, which is a student-led movement dedicated to fighting for the rights and dignities and safety of textile workers all around the world. Oliver, thank you so much for being here.
Thank you. Hey everyone. Hopefully you are here to hear about reproductive justice for trans communities. If you're not, you missed the big sign. I was not expecting a screen this big, so forgive my design. I did not focus on it. I wanted to give a disclaimer that this is a huge topic, and I'm only going to be talking for about 30 minutes, so we're not going to get to everything. But that's exciting because we have a Q&A after, and so if you have things that you're like, why didn't they say that? We have time to talk about it. And so I'm super excited to see what I missed that you all felt was super important. Here's what we're going to be talking about. I wanted to just kind of, again, I'm sure most of you already know, but frame what is reproductive justice, what does that look like for trans people, and then talk about the way that I kind of understand the main barriers to reproductive justice for trans communities. I also want to talk about self-managed abortion, because I don't think you can talk about reproductive justice for trans people without talking about self-managed abortion. I want to talk about barriers to move forward for trans people, because I think that is a large barrier to reproductive justice for trans people. You have deaf trans people doing the work for the work to move forward. And then we're going to talk about what we need to achieve reproductive justice for trans people. So what is reproductive justice? It's a human rights framework developed by Black women. Sister Song defines reproductive justice as the human right to maintain personal bodily autonomy, have children, not have children, and parent the children we have in safe and sustainable communities. So, how does that apply to trans people? Obviously, trans people give birth, trans people raise children, trans people get abortions, trans people adopt, trans people exist as a part of every community, and are obviously often routinely subject to limitations on our bodily autonomy. But here's where we also get to kind of dream a little bit. For me, reproductive justice for trans people is also going to include universal health care. I think that's necessary to achieve the reproductive justice that Sister Song envisioned. I think prison abolition is necessary to achieve the vision of reproductive justice that Sister Song envisioned. And I believe a removal of state control in any and all healthcare decisions is a critical part of that. But as for anything seeking to remove a barrier that prevents us from living our full and authentic lives, that's how I view reproductive justice. And specifically, that's how I think about reproductive justice for trans people and what we want to move toward. Here's how I kind of make sense. There's so many barriers. Here's the way that I kind of make sense of them and try to categorize them as legal discrimination, institutional cissexism and transphobia, interpersonal cissexism and transphobia, and then intersectional barriers, which are also often institutional, legal, or interpersonal. When I'm talking about legal discrimination, I'm talking about a lack of legal protections, actively harmful legislation, laws that don't consider the existence of trans people to begin with, and anti-abortion legislation. And I wanted to start with some examples of the ways that anti-abortion legislation disproportionately affects trans people, because I don't think that's something that we think about a lot or talk about specifically. So Trans people are obviously more likely to live below the poverty line. We're less likely to have access to transportation. We're more likely to face social isolation. So in states like Kentucky, where we have an outright ban, it's going to be much harder for trans people to get to another state to access abortion care. Gestational limits are also going to disproportionately affect trans people who have limited funds and access to pregnancy tests, as well as trans people who may have been misinformed about the risk of pregnancy and HRT, which is still unfortunately pretty common. And then again, with the higher rates of poverty, restrictions on insurance funding for abortion, especially with Medicaid, are obviously going to disproportionately affect trans people. Same with state mandated counseling. Basically any anti-abortion legislation you can think of is going to disproportionately impact trans people. The state mandated counseling and waiting periods are going to be a barrier for trans people who are underemployed or unemployed, having transportation to get there. That's also going to mean that they're going to have more connection and more interactions with the medical industrial complex, which is something we generally try to avoid. Parental involvement laws are also going to be extra prohibitive for trans youth who might be estranged from their parents. You're not going to be able to get a judicial, or you're going to have to go through the process of getting a judicial bypass in that case, which is also going to be traumatic if you're trans and you're having to go through the legal system. And then ultrasound requirements, like we had in Kentucky before we had a ban, can also be extra traumatic for trans people, especially if you don't feel a connection to the bodily process, the ability to become pregnant in general. Another aspect of those legal restrictions are insurance bans on gender-affirming care. I will go ahead and say this map is out of date, or it's not up to date, because Kentucky also has an explicit ban on gender-affirming care for Medicaid, but as you can see, a lot of states still do, and even more states don't have any explicit policy mandating coverage for gender-affirming care. That's obviously going to be a barrier to self-determination and therefore reproductive justice. Since we're here, I found that New York has a pretty cool legal landscape, all things considered. For reproductive justice, for trans people, like, legally, you're doing great. Like, that is very good. You have a lot of things that other states do not have. So for me, what I would think then is that means that trans people in New York are going to have a pretty easy time accessing healthcare and accessing reproductive healthcare, right? Not so much. Y'all's stats are pretty much the same as Kentucky, which I found really interesting. And we're going to talk about why that is in a second. But you have, I'm not going to read those to you, especially since the screen is so lovely and big. But basically, you all have about the same outcomes for trans people seeking care that we do in Kentucky, with a much worse legal landscape. Why is that? Probably mainly institutional barriers. So we have exclusionary language in every reproductive health setting. I know once again for Kentucky, our only abortion clinic was the Women's Surgical Center. For me as a trans person, going to the Women's Surgical Center is going to be at best uncomfortable. At worst, they're not going to treat me appropriately, and it's going to be a traumatic experience for me. There's also a lack of understanding about the needs of trans patients from doctors, and that is because education about our needs is not prioritized. And then, once again, I touched on this with the legislation, but anti-abortion legislation that mandates additional contact with providers leaves more space for discriminatory and traumatic interactions. Anytime you're making trans people interact with the medical industrial complex more than they absolutely have to, you are increasing the odds that they're going to have a negative experience. And that's until there's a huge societal shift, and there's a shift in the way doctors treat trans patients. That's going to be the case. There's also a huge focus on identity documents for accessing any kind of healthcare, which is going to be a huge barrier for trans people who are undocumented, trans people who don't have their name or gender marker updated, or those that do. For instance, if you have your name and gender marker updated on everything and you're trying to get something that might be considered sex specific, you're going to get a computer generated denial from your insurance company, which is going to be a headache, and you're going to have to appeal that. Or there's people who have different information on different documents. A lot of people have like their passport changed, don't have their ID changed. A lot of people have like their ID changed, don't have things changed with their insurance companies that can create issues with billing, which is a barrier to accessing care. We also have paperwork and intakes that completely erase or out trans people. I know most times I go to the doctor because I don't have my gender marker changed, and I'm outed immediately because they will like use the wrong honorific when they come out to the waiting room, and then we have a really terrible walk down the hallway, like where they're like, "Oh my God, so sorry, that was terrible," and I'm like, "Yeah, that was a room full of people for sure. Let's work on that." Insurance denials we talked about already. And then also, on top of, once we get there, not getting the care we need, this is something we know, that doctors, we can't trust that doctors are going to care for us or be able to help us. And that distrust can come from, a string of negative past experiences. Then once again, those higher unemployment rates, poverty rates, lack of access to transportation, being more likely to experience intimate partner violence, these are all things that make it harder to seek care. As well as having high rates of experiencing sexual assault. Half of trans people who took the U.S. trans survey in 2015 had experienced sexual assault. That is obviously a barrier to reproductive justice. It's a barrier to feeling confident seeking care, especially when some of, I don't know if I put the stats up there for sexual assault in medical settings, but some of that does come in medical settings from our medical providers. Some stats for insurance coverage. It's pretty bad, and you'll notice here, as we'll talk about more when we get to the intersectional barriers, insurance denials are at much higher rates for trans people of color, but overall trans people get a lot of insurance denials, which is a deterrent for people even seeking care, honestly. And then if you get that denial, often the process for appealing those coverage decisions is unnecessarily complicated. It requires you to have access to the internet, a printer, medical providers willing to go to bat for you, mailing supplies, and sometimes legal representation. And then often for gender affirming care, even with all of that, the end result is the same, and that denial is going to be upheld. And so, because that is so emotionally taxing, you're having to make yourself really vulnerable with like a bureaucratic process that has not been responsive to you, like your insurance company. You're having to explain to them why, getting estrogen is important for your livelihood and your mental health. Like, a lot of people just choose not to do it and go without their medically necessary care because they don't want to have to traumatize themselves to get the care they need. Sorry, I'm taking a breath. It's kind of hard to talk in a mask. Interpersonal barriers. I feel like that is something a lot of people have a good grasp on. There's broad harassment for trans people in traditionally gendered healthcare spaces like abortion clinics. I'm going to be honest, I've never in my life lived in New York, so I don't know what it's like here. But I know in Kentucky and Indiana, it's kind of weird to be trans in public. It's a little, it can get a little iffy in closed spaces. Like, people are not going to necessarily be super normal to you. And with that, that is especially true with medical providers, often who have, at very best, kind of outdated views of trans people or a lack of understanding of like the nuances of trans identity. And transphobic interactions with front desk staff. I know my primary provider is super awesome. He is a great person. I'm definitely going to have a terrible interaction with everyone else before I get to him, and that's something a lot of providers don't consider. So I'll hear people like recommend him, and I'm like, okay, yeah, recommend him. Please, like, warn people. We'll talk about that later. How access to information is like part of that like process for moving toward reproductive justice. Like, be very super clear with people. If you're saying, okay, this doctor is great, they're going to talk to 10 other people before they get to that doctor, and they could be experiencing trauma in the meantime. Once again, those stats are not super pretty. We hate to see it. Then talking about those intersectional barriers, so all of the barriers we talked about are going to disproportionately affect trans people of color. They're going to disproportionately affect trans people living with disabilities or chronic illness. They're going to disproportionately affect trans people who are undocumented. Anyone living at an intersection of two or more marginalized identities it's going to have compounding effects, which like we know, but naming it specifically, those restrictions on abortion funding and those outright bans are going to disproportionately affect trans people who face high rates of poverty. We know trans people living at the intersection of marginalized identities are going to face high rates of poverty. Heteronormativity or homophobia. So kind of the understanding that, or the not understanding why trans people might need access to reproductive health care is something I've encountered. Doctors not understanding, okay, like you're a trans masculine person, you have sex with like cis women. Like this pursuing heterosexuality that still exists for medical in the medical industrial complex creates another barrier in itself. And then just having those increased barriers to healthcare as a whole means that trans people experiencing multiple points of marginalization are less likely to know they're pregnant early on, and those gestational limits are going to be an additional barrier. Again, medical racism is going to intersect with transphobia structurally and interpersonally, making healthcare especially traumatic for trans people of color. And then we talked about identity documents before, but that is obviously going to be a huge barrier to seeking care, as well as lack of language justice at clinics. If you're already having to communicate in a language that is not your first language, and you're having to communicate about like your gender to your medical provider, that's going to be incredibly difficult and almost an insurmountable barrier. Now on to a fun topic. Self-managed abortion. I love self-managed abortion, and I think specifically for trans people, self-managed abortion can be really liberatory. In the same way, trans people who end up having to manage their own HRT, that can be liberatory depending on the option you have. But specifically for self-managed abortion, that allows trans people to avoid most of the barriers we talked about before. You're having less interaction with potentially transphobic providers and front desk staff. You're avoiding potentially getting outed in public. It's often lower cost, doesn't necessarily require access to transportation, and abortion was by mail. And then there's also the aspect of increased privacy, which for trans people also often does mean increased safety, which is especially important considering the high rates of domestic violence for trans people and the epidemic of violence just existing in public that Black trans people face. There was actually a study that was done in 2019, it got published in 2021, specifically about abortion without clinical supervision for trans people. I was super stoked when this came out. But it was not shocking to learn that 19% of trans people who had ever been pregnant had attempted ending their pregnancy on their own. And then on the right, we have a breakdown of the 4 top ways that people had an abortion without clinical supervision. And what I want you to note there specifically is that abortion pills don't make the list. Even though we're talking about in 2019, there had already been a lot of information spread about Plan C, about how to access abortion pills by mail. And so to me, what this says is that there's a lack of information being spread specifically to trans communities about self-managed abortion, and that is an option for us. And here I also have some quotes about why people chose self-managed abortion, just pointing out the kind of things I also already said. But like that desire for privacy and to avoid those structural issues, as well as general like mistreatment in clinical settings. I just wanted to say, because I think it, when we're talking about reproductive justice, and a lot of times when I am in like organizing spaces for reproductive justice, we talk about gender affirming care and we talk about abortion separately. For me, my abortion was gender affirming. That was gender affirming care for me. Being pregnant would have been extremely dysphoric for me. So having an abortion was gender affirming care. And I think it's important to note that and note that like solidarity that can come from those shared experiences. I just wanted to talk about barriers to movement work for trans people quickly, because I'm going slow, I guess. But trans people have been made into an extremely vulnerable population by a variety of societal and legal factors, and a lot of cis people are unaware of how pervasive transphobic violence affects every aspect of trans life. So here, I'm highlighting that we're more likely to live in poverty, we're more likely to be unhoused, we're more likely to be experiencing discrimination at places of public accommodation. And what do all these things mean together when we're talking about movement work? It means we are barred from aspects of public life, which include the ability to organize with our communities. If you are worried about staying housed, if you are worried about feeding yourself, if you are worried about being harassed in public, you're not going to be able to go to a meeting. You're not going to be able to access community in the way that you might want to. And then I also wanted to say here that that's intentional. People want that. That's the point of bathroom bills. That's the point of Don't Say Gay bills. The point is to remove trans people from public life. The barriers specific to movement work. Capitals are really hostile to trans people. I know in Kentucky our capital is Frankfurt, and I have to go there somewhat regularly, and it's bad. It's just bad. They say bad things about trans people straight to your face, and trying to work with other organizations working for issues that are not trans-specific, working with environmental coalitions, working with labor activists. When I'm going with them to Frankfurt, there's not really an understanding of how it might be different for me to be alone with a legislator who, last week was trans girls shouldn't play sports. It's a different dynamic, and there's not a lot of cross-movement understanding that recognizes that. And then there's also just a broad lack of investment. That's something I've noticed organizing with other reproductive justice organizations is sometimes people feel engaging specifically with trans issues, even specifically in reproductive justice, will alienate their base, which is bad. That sucks. That really sucks, and is not just not good because it's not helping. It's actually bad because then you're further marginalizing trans people. You're saying, okay, this is actually something that's controversial and something we need to avoid if we want to have a broad movement. Also, gendered language, especially pervasive in abortion work, is a barrier for trans people getting involved in abortion work. And then if trans people point that out, we're often treated as distracting from the real issue or being treated as outside agitators rather than people also working toward expanding abortion access while advocating for that expansion for their own communities. That's something I've experienced specifically, just being in spaces especially post-Roe, is this really what we need to be talking about? We can do two things at once. I'm confident in our abilities as a society to handle two things at once. And then so for me, what do trans people need to achieve reproductive justice? In my view, greater support and access to participation in movement work, systemic change, understanding, access to information, and then mutual aid, accompaniment, and advocacy. So supporting trans people in movement work is that first piece. Actively engaging with and uplifting trans organizers, which means long-term community building with trans people and seeing trans people as a part of your community. Utilizing whatever resources and platforms you have to uplift the needs and asks of trans organizers, which are comparatively very underfunded. I don't know why there's a question. Oh wait, how can you? That's a question. And pushing repro orgs to acknowledge the life-threatening and fascist nature of anti-trans legislation, not just as a side note, but as a key reproductive justice issue. And then kind of what I talked about a second ago, about pushing for advocacy trainings that acknowledge what it means to be trans in public. It's going to be different for me to try to do door knocking in Kentucky than it is for a cis person. Maybe you shouldn't send me out to do that alone. Maybe you give me a buddy. You can also push organizations that are working for justice to treat their workers better, treat movement workers better, because that is going to allow people who are more marginalized to get involved in movement work. If you don't have to take a really crappy salary to do the work, then like you're going to be able to do the work. Also having that base knowledge of what resources and organizations exist in your area, and helping facilitate meaningful cross-movement solidarity between reproductive justice groups and trans justice groups. I don't know what kind of groups you all have on campus, but like there's actually a lot that can come from just like co-hosting an event. People are like, oh, these things are kind of connected. And you start talking and thinking about the ways that your issues relate to one another and things that you can work on together. So just creating those spaces can do a lot itself. And then systemic change, there's obviously more. There is more needed than this, but shifting how as a culture we talk about abortion care. And I talk about this when I've done like trans 101 trainings with doctors, like just use the term that fits what you mean. Think about what you actually mean. Like, you don't have to say like person with the uterus, actually, you can just say like pregnant person or like abortion seeker. And people are gonna actually have a much less weird reaction to that if you're already talking about abortion and you're talking about a patient. Illegal end to legal restrictions on abortion, insurance coverage for abortion, as well as gender affirming care, universal health care, doctors who understand how to care for trans patients, a shift toward empathetic care in the medical system, and updated record system and intakes. I'm assuming that other people have other ideas for systemic change that is necessary, so I'm going to end it there. Understanding. So how can we move toward understanding reproductive justice for trans people? We can uplift and highlight trans abortion stories. I know myself, you have to actively seek them out. But I have some resources at the end from trans people who are willing to publicly share their abortion stories that you can listen to, internalize, use as a resource. Also acknowledging those additional barriers to abortion care for trans people. Pushing yourself, as well as those around you, to engage in deeper discussions around gender justice, evaluating and questioning your own assumptions as well. And then access to information, we already talked about a little bit, but expanding access to an education around self-managed abortion. Specifically, I do think we need to be doing that geared toward trans communities, thinking about the way that trans communities share information. Because it can be different. And so sharing community-specific resources, because obviously there is a gap there. We had abortion pills fairly accessible by mail in 2019, and trans people were using harder to access methods to self-manage their abortion. There's obviously a gap in that resource. Also understanding what your local climate is. And with that, something that I try to focus on a lot is trying to democratize information about gender affirming care and abortion access in your area, the most information possible. Literally, what will it be like if I go to the clinic, step by step? Can I find that somewhere online? Because that's going to make it much easier for me to be able to access care. And also being aware of other local resources available in your state and community so that you can distribute those resources, get them to people who need assistance. And then ending on one of the most important pieces for me, which is mutual aid, accompaniment, and advocacy. So direct assistance with financial need, as well as practical needs like transportation, support at appointments, help navigating bureaucracy. These are things that trans people need to be able to access healthcare. Because that system-wide change doesn't happen quickly. And as individuals invested in reproductive justice, we do have to kind of take it on. It sucks that we live in a society that requires us to do so much, but that's where we live. And if we have the ability and knowledge to provide that direct assistance, I think we should. And I think that's how we move closer to reproductive justice. And that's because this person-to-person aid is super impactful and allows people to think about other things than like, how am I getting to the doctor? It allows them to think about like, how can we actually make this better? It allows them to dream for more and organize for more. Some resources. So that first link is a video series of trans people telling their abortion stories. It's super cool and super impactful. There's a language guide for talking about abortion and reproductive justice in trans communities. There is a reproductive health section specifically for the LGBTQIA Health Education Center, which can be helpful. It is a helpful resource to send your doctor if your doctor is not knowledgeable. I've been known to just email them a link, be like, hey, check out this video. You can learn things. And then We Testify is a really cool page that has a glossary and some more trans abortion stories talking about the intersections between queer and trans justice and abortion access. Also linking the US Trans Survey, because I pull a lot of statistics from there. They just finished another round of the US Trans Survey. I hope that if you're trans, you took it, because those surveys are super helpful for getting people to understand what it's like to be trans in America. I also have our YouTube page linked because I spent a lot of time walking step by step through the insurance appeals process, and so if that's something that you're going through, there is a resource, because I could not find one online. You can also email me. If you have thoughts or questions that you don't feel comfortable sharing out loud, you can write down my email, and you can email me and we can chat. Always happy to talk to anyone. And that's all I have.
Questions and comments?
Oh, hi. So happy that you're here. So I'm also a medical professional and I'm also trans. So like it was really hard because in the agencies I work for outside of the school, I've been never gendered correctly by my own coworkers. So being a patient is a huge undertaking. I remember at the beginning of the slideshow, you talked about kind of the misinformation about HRT,
Yeah.
and so I thought if you could maybe elaborate on that and any other kind of barriers, even contraception, going through that whole medical process. So I don't know, for me it's really daunting. So yeah.
Yeah, mainly I'm talking about, so when people start HRT, when I started HRT, and another thing we do with my program is we go with trans patients to their appointments. So what I've heard endocrinologists and primary care providers convey to patients is that there's a very low risk of them getting pregnant if they're on testosterone still, which we know is not true. Doctors just don't get new information sometimes. They don't seek out new and relevant information, and that was a thought that people had 10 years ago. The same with people who are going on feminizing hormones, being told that they have a much lower risk of impregnating someone. That's mainly what I'm talking about there. And that can come from medical professionals. It also sometimes comes from each other. We kind of spread some misinformation. I see that a lot. I'm in a lot of trans Facebook groups because that's the easy way to talk to trans people in other states. And I see a lot of people saying that. It's really irritating. Your other part of your question was about contraception.
Yeah.
Yeah. Yeah. Yeah. So Kentucky actually is half birth control desert. We have a lot of counties where you cannot access most forms of birth control, which is something we've been trying to work on with local health departments. But especially for trans people, I honestly, if somebody in Kentucky wants to go on birth control, I'm here's an online mail order pharmacy where you can talk to someone online for 2 seconds and they'll give it to you. Just look up what you here are some resources to help decide what method would be best for you. Obviously that's not going to work if you're talking about getting an IUD or something.
Yeah.
Which is an incredibly daunting process for anyone, but yes, for a trans person specifically. Yeah.
Thank you.
Yeah, no worries.
So I'm just curious to hear what your thoughts on generally like self-managed, like community managed healthcare, because I don't really know the situation in the US, we just arrived here. But in Germany, going on HRT is basically like it's incredibly hard and it's a very humiliating process because there's no such thing as trans-specific care, but one basically needs to be treated alongside with women entering menopause. And so most people start HRT through community resources, so without actually getting a prescription, like I also did that. And so, and generally it's in the community, there's a lot of mistrust from medical professionals, and so all health resources I had access to when I was in Germany was only through anecdotes, only through the friend of a friend of a friend. And I was really lucky to be in a network of people that actually knew what they were doing, but not everybody has, it seemed like. So yes, like self-managed healthcare has advantages and disadvantages, and I just wanted to hear your thoughts on that.
Yeah, absolutely. I also started HRT myself as well. I bought some testosterone gel off a friend who switched back to injections. That is super common. I know in Kentucky that's super common in Western Kentucky because there are like no providers who treat trans patients in Western Kentucky, and that's a long drive to make for folks. I think that's for me a lot of where like the democratizing information comes in. Like, how can we get like actual like accurate medical information? Like, I want the same amount of information my doctor has. If I want it, I should have access to the same amount of information, and I should be able to find it easily. So I think the closer we come to, you know, like, I don't know, I started testosterone 6 years ago, and the stuff I found online 6 years ago was not helpful compared to like what I see people talking about today. I see people having like really nuanced discussions about like dosing and like which providers can provide like which kinds of care. And so, I mean, I think you're right. Like there are advantages and disadvantages. I think it would be great if it was an option. Like people were doing that because there was like that's what they chose. Like if people choose self-managed abortion, I think that's great. I don't think that's a replacement for people being able to access clinical care if that's what they choose also. I think people should have as many options as possible. So if people want to seek community care, I don't think we should like stigmatize that or discourage that at all. But I think it sucks that mostly people aren't coming to that because they're choosing that, or coming to that because there are no other options. So I think we can work on both ends, you know? We can work on like spreading better information like within the community, spreading better access within the community, and also pushing, you know, as much as you can push like the medical industrial complex to be better, like pushing them to be better as well, because there are always going to be people who don't have the same connections to community that I had, or that like maybe you had, and then they're not going to be able to access things outside the clinical setting. Sorry, that was a bit rambling. Did I get somewhere? Okay.
Yeah, I also had a question about self-managed abortion and this sort of like move to shift healthcare into community self-managed, privately managed, or app-based systems, right? And as a consumer, I realize the freedoms that brings, right? And for sure, I recognize the concerns that you're raising specifically for trans people, but there is still sort of a hesitation on my part, and maybe you were also sort of like going in the direction of voicing some of that hesitation in terms of like system change would imply that we advocate for the US healthcare system to change its treatment of trans people, right? Or to change its treatment of people who seek an abortion. And it feels like the privatization of that is sort of skirting the issue on the one hand, which is great in the short run, but there is this sort of concern, like what does that do in the long run to the system? Will the system begin to rely on us seeking all of our care privately, the way that depression medication is now also completely available through an app, right?
Yeah. Yeah, no, I think, yeah, no, I definitely feel that tension. And I think like, as simple as it sounds, like I think the answer is like voicing that and doing both.
Yeah.
Like we can say it's not, I love nuance, we love nuance. I have a necklace at home that just says, it's just like a chain and it says nuance. I didn't wear it today, unfortunately. But like we can hold both of those things. We can like hold that like, it sucks that like I can't go to a hospital and get the care that I need. That sucks. And that should be better. Also, I want an alternative now. Like I want something I can do now while I'm like doing that work. And I think I do see trans people specifically talking about that a lot. Like, hey, I'm not seeking care right now, or like I'm talking to my friend who's a nurse. I do that often. I feel bad for my friends who are medical providers because I will do anything to avoid the ER. Like, please tell me this is fine and I can just wait a week. So like, but when that happens, that kind of motivates me. I'm like, all right, let me go back to this conversation. We have a big medical system in Louisville, Norton. I don't know if there's Nortons in other places, but like talking to them, I'm like, okay, let me send them another email because I had an absolute dreadful experience last time I was at their ER. That's the closest ER to me. I think I'm having a heart attack and I don't want to go there. Like, that's absolutely a problem. But also, would it be better if I could if I could have immediately not tried to contact my friends who are nurses, if I could have just like accessed something online immediately that like a nurse like we have some of those. But like how can we do both? And I think when we have to do one, when we have to do the like I'm skirting going around, I think we feel like this, like it's great, but it also sucks that this is my only option right now. Like in Kentucky, like I mean, it's not legal, but like I could order a medication abortion online. They will ship it to me. It sucks that I'm having to do that and I don't have the option to go to a clinic. And I think people feel that, and I think that is like a really real issue. I think we're also going to like, from a legislative perspective, we're going to see more like regulation around like telehealth. That's what I'm like seeing coming, specifically also around like self-managed abortion, which is really unfortunate. They want to take away that option as well. They want to make it so people have no other options. So I think we have to push for both. Like we cannot give ground on either side. Like we have the right to self-manage our own abortions and we have the right to competent medical care from a medical professional if that's what we choose.
I'm curious, it's not a super deep question, but I'm just curious like what exactly it is you do on the day-to-day, your organization, like what are you working on now, what's your priority, and also I know that the organization isn't just focused on trans issues, so how are you working with your other coworkers to sort of discuss the crossovers that you sort of pointed out to us in reproductive justice?
That's a great question because it's one I have an answer for and I don't have to think while I'm talking. So Kentucky Health Justice Network, we have a couple different programs. We started with an abortion fund, so we are like primarily an abortion fund. But we were also one of the first practical support programs for abortion. So we have volunteers that transport people, and now we're transporting people out of state. We're driving people to like Southern Illinois from Kentucky, sometimes to Indiana, to Bloomington, but usually to Southern Illinois. We're getting people plane rides. We partner with a group called Elevated Access that will like fly people seeking abortion out in the state of Kentucky. We offer people childcare. We give people gas money if they want to drive themselves. We offer interpretation services. We have a language line that people can call at the clinic so that they don't have to like struggle to communicate with whatever clinic worker they're talking to. So that's where like our abortion fund is focused. We also, relevant to college students, we host a yearly conference. It's maybe not relevant to New York because it's like red state focused, but like red state organizing around reproductive justice. It's still interesting, and people from not red states are obviously welcome to come and welcome to present also. We also work on birth control access. It's a lot. We work on birth control access specifically in Eastern Kentucky, where all those birth control deserts are. So my coworker Kelsey there talks to and trains like health centers in Eastern Kentucky on like different methods of birth control, and like, you know, I think they call it like one key question, like trying to ask if someone's like pregnant early so that they can have it, like before we had a total ban, like before they hit a gestational limit, that they can access abortion if that's what they wanted to do. And then for my program, a lot of what I do is the direct support. We have volunteers for my program who go with patients who are trained to kind of facilitate conversation between like providers and patients, which is like really hard. This was not in my bio, but I got another little degree in conflict resolution. And that's been really helpful because you really have to like kind of walk on eggshells with doctors, and so that's what we teach our volunteers is like how like talk to the patient beforehand, figure out what they need out of this interaction, what they need out of this appointment, and like figure out how to like finesse the doctor to get what they need. And so that's a lot of what people do. And then I also end up doing a lot of that as well, sending people resources. There's no other like statewide trans organizations in the state of Kentucky. So if someone needs to like get on Medicaid, there's no one else for them to talk to. So we're like doing a lot of that. And then I'm also, my job description's like wild. So I'm trying to think of my job description. We do like monthly educational events. So I bring in therapists to talk about, like we talked about grounding as a way to like deal, like actually grounding to deal with dysphoria, which was a wild concept to me because, you know, the intuitive response is to dissociate, but it's actually really helpful. So bringing in like trans medical professionals to like talk directly to the trans community and offer resources. Also making guides like that. Like I have an updated guide of like which providers in the state offer HRT, and then like within that which do informed consent for HRT, what trans identified therapists exist in the state. We actually have a lot in Kentucky, fun fact. A lot of trans therapists in the state, which is sick. What else? We also do like legislative advocacy because there's no other, I don't feel particularly passionate about that, just to be 100%, because it's Kentucky. When I think change often doesn't come from the legislature, but there's no other like trans groups in Kentucky. So when we have like, we already have pre-filed another anti-trans bathroom bill, we got an anti-trans sports bill last session. There's no one else to like address those things, so we end up kind of de facto having to. We're also working on, I'm sorry I've been talking a lot. I am really excited about a lot of things we're working on. We're working on removing the Medicaid exclusion on transition-related care in Kentucky, which I am super stoked about because we're making good progress with that. Talking to our like head of health and family services, which would be incredible for trans Kentuckians on Medicaid to be able to like access gender-affirming care, because right now they can't.
Yeah, I guess pulling on your conflict resolution background, I've been really struck by your emphasis on democratizing information and just thinking about the ways that one can do that in their interpersonal interactions with people. So I was wondering if you have any recommendations for addressing transphobic comments in reproductive justice spaces and how to address that if and when it comes up.
Yeah, I think that's super dependent on what it is, like what the because for me, I have a very different reaction and strategy if someone, if I think someone is just not knowing, is being unknowing versus being like intentionally disrespectful. If someone is just being unknowing, like not knowing, like if someone is being ignorant about trans people and our need for abortion access, I do just like put myself in front of the bullet often, which is not an option that like everyone has, but I'm just like, hey, like I did that when I trained our Planned Parenthood on like trans competency, and because of conversations I had with clinical staff, which I had to be constantly like, the way, like I'm trans, I have had an abortion. How would you talk about that experience for me? Like, what would you say? Would you say that that was women's health care, me accessing abortion? Or would you say it was me accessing abortion? Like, or if you really, I have no problem saying abortion. I think we should say abortion now. I think we say reproductive health too much when we mean abortion. But if you want to go that route, just say reproductive health. Did that get it an answer? If you're talking about language specifically, that German resource from the Transgender Law Center is a super helpful link to send people because it's really clear and does explain what that need for shifting language.
So, social movement-wise, I mean, like, connection and collaboration through organizations is vital. But also, like, it is what you said, like, interesting because there are a lot of organizations like that work still on social justice issues that are transphobic out of maybe choice, maybe just because of laziness and tradition. So, in establishing, and again, I don't know if you have direct experiences with this, but I'm just still interested in your thoughts on this, in trying to establish dialogue with such organizations. Is it possible to do that without falling into the narrative, kind of diminishing oneself, diminishing the cause, and like falling into the trap of presenting oneself in very simplistic ways and in very non-threatening ways, just to make the other people uncomfortable? So not to make the other people uncomfortable.
Yeah, I think that's also a really like nuanced and individual decision. For me, like I do kind of make a calculation, like is it worth it? Based on like what I think is someone in this organization going to be receptive to me? How are they going to like treat me when I come with this, I critique, when I come with this critique, how are they going to respond to that? Are they someone who has been responsive to like critiques in the past? I mean, in general, I don't often feel like I'm having to like flatten myself to do that. I will just say it as simply as I can usually. I try not to give a lot of labor until I know they're actually invested. Like if they want to continue a dialogue, I will like, okay, like let's talk about this is important. But at first I will just be like, hey, not to go back to the simple example, but like, hey, I'm trans, I've had an abortion. The language you're using is part of why I found it hard to access care. Just so you know, just as simple and like as little effort for me as possible. Like this is something you might want to consider if you want to talk about it more. Like, and I'm willing to. Like I'm here because if they're not willing to engage further or they feel defensive from that initial, just like, hey, I think this was kind of harmful. To me, it's usually not worth it. Maybe I'll try again. Maybe I'll try again next year. Maybe I'll find someone. Usually, I think it is about finding one person. Like as much as it is about connecting organizations, it's about connecting people. There are organizations where I have had a negative feeling about the entire organization, and then one person started working there, and I was like, oh, they can help. Let me meet with, let me have coffee with them. Like we're going to talk, and we're going to see if they can talk to their coworkers because they're within the organization. So like finding that I think is really helpful if you feel invested in making that change. But I also don't think there's anything wrong with just being like, this kind of sucked. One sentence explanation, and if they want to do better, then they will. They'll ask follow-up questions. If not, then they have to have a little investment to actually move forward.
Anyone have a final question or comment? You want to say something about why this is not a blue state, red state issue?
Yeah, I think the statistics about how trans people are still treated in New York in healthcare settings really illustrates that. I don't think, especially for trans people, I don't think life in blue states is that much better from having trans friends in blue states. And I don't think, I think when you're talking about reproductive justice as a whole, remember you're talking about abortion access, like, you know, a lot of states you can still access abortion, in Kentucky you cannot. I think as people like invested in like reproductive justice as a whole, whether like we live in a blue state or like we live in a red state, we know that there are people that live there. Like I think that's something that we've talked about a lot at that like Take Root conference for like red state reproductive justice is the humanization of people who like live in states where there are bans. Like you may be grateful that you live in a state without a ban, but you should still feel that urgency. Like feel the urgency of like, oh, there are people here who cannot access healthcare they need. Like there are people who are going to have to continue with a pregnancy they do not want because they're not going to be able to get out of state. That's heavy, and I think that's heavy. Like I'm getting an hysterectomy next month. Like I'm not going to have to access abortion after that, but it still feels heavy to me to know that there are other people who are not going to be able to access abortion.
Thank you so much.